If you've ever had a cold that seemed to drag on for weeks, or you found yourself battling with constant facial pressure, thick nasal mucus, and a stuffy nose that just never fully clears, what you may well have been dealing with is chronic sinusitis, rather than just a bad bout of a common cold. And if you're an athlete, you'll know just how frustrating and limiting it can feel trying to push through a hard training session when your sinuses feel completely blocked and your head feels heavy and every breath feels like it's going through a wet sponge. So in this episode, I'm going to walk you through what chronic sinusitis is, what the typical features are, and why it specifically matters if you're an athlete. I will also explain what your treatment options can look like, and crucially, when it's sensible to think about surgical treatment. If you're new here, I'm Dr Guled Jama, a consultant ear, nose and throat surgeon based in London, and I specialize in nasal airway surgery and optimizing breathing for sports performance. And in this series, my mission is to break down common nasal and sinus related problems that affect many of the athletes that I see, and to give you a clear overview of the treatment options that are available to help you breathe better and perform at your best. Let's get into it. Okay, so first things first, what exactly are your sinuses? More accurately described, your so-called paranasal sinuses are a collection of air-filled spaces and cavities that sit within the bones of your skull, surrounding your nose and eyes. There are 4 pairs of them. The maxillary sinuses are the largest pair, sitting in your cheekbones on either side of your nose. The frontal sinuses sit in your forehead, just above your eyebrows, while the ethmoid sinuses are a group of small, interconnected air cells that sit between your eyes. And finally, the sphenoid sinuses are deeper, tucked behind the ethmoid sinuses, towards the center of your skull. All of these sinuses are lined with and share the same continuous mucus lining as the inside of your nose, and each one drains into a small natural opening into the nasal cavity. Now, the sinuses have several important functions. For a start, they contribute to the warmth and humidification of the air that you breathe in. They're also thought to play a role in producing nitric oxide, an important molecule which helps relax and dilate blood vessels and support more efficient oxygen uptake within the lungs. Given that they're filled with air, they also naturally lighten the weight of the skull, and they help protect your brain and eyes in the event of a facial impact. So essentially, they're not simply empty spaces, but they play a vital physiological function. The term sinusitis simply means inflammation of the sinuses, and in the vast majority of cases, it starts with a viral upper respiratory tract infection. In other words, a common cold. The nasal lining then becomes inflamed and swollen as your immune system reacts, and the drainage openings of the sinuses can therefore narrow or block off. Mucus then builds up inside the sinus cavities, and the environment within the sinuses can shift in a way that allows bacteria or fungi to multiply and grow and take hold on top of that viral infection. And this is when it becomes more problematic. There's an important distinction between acute and chronic sinusitis, and it matters when we start thinking about treatment. Acute sinusitis is generally a short-lived episode. Symptoms typically come on fairly quickly, and in most cases resolve within a few days or weeks, either with or without treatment. It's extremely common, and most episodes are viral in origin and often self-limiting, meaning they settle on their own or with supportive measures, without the need for antibiotics, for example. However, chronic sinusitis is a different beast altogether. By definition, it means that your sinus symptoms, which include nasal blockage or congestion, facial pressure or pain, a reduced or absent sense of smell, and thick or discolored nasal discharge, have been present for 12 weeks or more. And this is despite appropriate initial treatment. And that's a really important and relevant threshold to understand. It's therefore not just a prolonged cold. It becomes a persistent condition in which the inflammation inside the sinuses has not resolved in the way it normally should. And in some circumstances, in the context of prolonged inflammation, it can become associated with the formation and development of nasal polyps, which are soft, jelly-like growths of inflammatory tissue that form in the nasal and sinus lining, and which can significantly worsen the degree of nasal and sinus blockage. Let's talk about why this matters specifically if you're an athlete. Think about what it feels like to breathe when your sinuses are acutely inflamed. The pressure, the heaviness in your face, the congested airway, the thick mucus. And now imagine trying to maintain that kind of effort during a run, a swim session, or an interval workout. It's genuinely very difficult. And the problem with chronic sinusitis is that many athletes may adapt to it over time. They may just adjust their training, they may accept that their breathing will feel labored or restricted, and they stop expecting to be able to breathe comfortably during exercise. They may assume it's normal or that it's just the way things are, but importantly, it's not normal, and it certainly doesn't have to be permanent. There are some important and specific ways in which chronic sinusitis can undermine athletic performance. Firstly, it contributes directly to nasal obstruction, making efficient nasal breathing much harder during exercise. When the sinuses are congested and the drainage pathways are swollen and partially blocked, the nasal airway as a whole becomes much more narrow and more resistant to airflow, which makes effective gas exchange much more difficult. Secondly, a reduced sense of smell and taste, something that is very common in chronic sinusitis, particularly when polyps are present, can have an important knock-on effect on appetite and nutrition. And this can really matter enormously for recovery and sustained performance in training. And thirdly, significant sinus disease can disrupt sleep quality, and we know from a growing body of evidence that sleep is one of the most critical independent variables when it comes to athletic performance and recovery. And finally, the fatigue and systemic inflammation that accompanies poorly controlled sinusitis can blunt training and adaptation and delay recovery in a way that can be genuinely limiting for motivated athletes. Let's talk about treatment. The mainstay of initial treatment for chronic sinusitis is medical management. For most people, this is where things start, and for many, perhaps where they also end, because medical treatment is often sufficient to keep symptoms under control. The cornerstone of medical therapy is the use of intranasal steroids in the form of aerosols or drops, used consistently and correctly over a sustained period of time. Steroids have an anti-inflammatory property, and so they help reduce the inflammatory burden within the nasal and sinus lining. And they can be particularly effective in cases where nasal polyps are present. However, the key is using them consistently, as many people simply don't see the benefit because they use them sporadically or they stop too early in the treatment course. Daily nasal saline irrigation is another simple but highly effective measure. Rinsing the nasal and sinus passages with a saltwater solution helps to physically clear stagnant mucus and debris, reduce inflammation, and maintain a healthier nasal environment. And there is good clinical evidence supporting saline irrigation as an adjunct to nasal steroids in chronic sinusitis, and it has a very good safety profile. If you haven't tried a dedicated saline irrigation device such as a squeeze bottle or a neti pot and you're dealing with chronic sinusitis, I would strongly encourage you to try it. In a separate video, I show you exactly how to use nasal sprays, nasal drops, and sinus rinses properly, because getting the technique right really matters. So do check it out after this one. In some cases, your doctor may prescribe a short course of oral steroids to help rapidly reduce severe inflammation and polyp burden, particularly if your nasal blockage is pronounced. A course of antibiotics may also be helpful if there is clear evidence of a bacterial infection that is not settling. For a small subgroup of patients with particularly severe or treatment-resistant disease, there is an emerging role for newer injectable biologic medicines that target specific inflammatory pathways and help disease control. However, this is somewhat outside of the remit of this discussion. And although these treatments are becoming more widely available, they're certainly not yet part of routine management and are typically reserved for very carefully selected individuals under specialist care. So where does surgery fit into all of this, and what does it involve? Surgery for chronic sinusitis, often called functional endoscopic sinus surgery, or FES for short, is generally considered when symptoms are persistent and significantly affecting your quality of life, despite an adequate trial of medical treatment. And the word adequate is important here. A reasonable trial of medical treatment typically means at least 3 to 6 months of consistent, well-used nasal steroids, regular saline irrigation, and any other treatments your specialist has recommended. Surgery is not an appropriate immediate option after just a few weeks of sinus symptoms. However, if you continue to struggle despite a full and appropriate course of medical treatment, it becomes a very reasonable and evidence-based option to consider and discuss with your specialist. And there is clinical evidence to back this up. A recent large clinical trial from the UK looking at adults with chronic sinusitis found that once people had really committed to proper nasal sprays and rinses, but were still struggling, those who went on to have sinus surgery had a much greater improvement in their symptoms and day-to-day quality of life than those who carried on with medical treatment alone or added longer courses of low-dose antibiotics. So surgery has a clear role and has been proven to make a real difference to how patients feel and function. There are specific indicators that should prompt a referral to an ENT specialist and a discussion about surgery, and these are important to understand. They include persistent and significant nasal obstruction that has not responded adequately to maximal medical treatment, ongoing facial pressure or pain, or a marked reduction in the sense of smell that is consistently present and impacting day-to-day life, and recurrent acute sinus infections despite appropriate management. Objective findings on clinical and radiological assessment are also key. For example, evidence from nasal endoscopy or a CT scan showing severely diseased sinuses with drainage pathways that are significantly obstructed and that medical therapy alone cannot address strongly supports the case for surgery. Equally, large persistent nasal polyps that remain unresponsive to medical therapy are often one of the clearest indications for surgery, as they represent a physical barrier that intranasal treatments alone are unlikely to resolve. For athletes, there are additional considerations worth thinking about when discussing the timing of surgery. How significantly is your sinus disease affecting your training, your performance, and your recovery? Does your training and competition schedule allow a realistic window for surgery and proper recovery without compromising a key part of your season? These are conversations to have early, and your surgeon should help you plan this sensibly. If you're considering sinus surgery, I have a separate video on this channel where I go through exactly what the procedure involves, the intended benefits, the possible surgical risks, the recovery process, and what results you can reasonably expect. So I would encourage you to also watch that video after this one. To bring this all together from an athlete's perspective, if you've had persistent sinus symptoms for 3 months or more, and you have genuinely committed to a full course of medical treatment, in other words, regular nasal steroids, saline irrigation, and any other relevant additional therapies that your doctor has recommended, and you are still struggling, then a referral to an experienced sinus surgeon is absolutely the right next step. On the other hand, if you have not yet had a proper sustained trial of medical treatment, or your use of nasal therapy has been inconsistent, then that is where the focus should be first. And I would recommend you discuss treatment with your doctor. In many cases, well-delivered medical treatment may be entirely sufficient and may allow you to avoid surgery altogether. If you found the information in this video helpful, I would really appreciate it if you could consider subscribing to this channel. I'd also love to hear from you in the comment section. Are you currently managing chronic sinusitis alongside your training? Have you had sinus surgery and noticed a change in your performance or recovery? Do let me know, and please share any specific topics or questions you'd like me to cover in future episodes. Your feedback genuinely helps me plan educational content that is most useful for you, but also helps other athletes discover clear evidence-based information so they can make better decisions about their health and find reliable answers to help them breathe better and perform at their best. Thank you very much for watching, and I'll see you in the next one.